Good afternoon. Welcome back to Monday Reading Live. This is me, Vandana PS, joining you from Neethu's Academy. First of all, Eid Mubarak to each and every beautiful hearts who are watching this video. So as usual, first of all, I'll show you a sample question from part B. Then we will move on to part A. Okay? So I'll give you 2 minutes for doing the question. Then we will discuss the answer. So here comes the question. Welcome back. So yes, this is the question. Have you all done the question? Okay, Yogeshwari, Sarala, Dennis, Cynthia Maria, Aniha, Anus, good afternoon. Yes. Okay, so this question comes from the category, second category, which is a manual. Okay, and what are you reading for in a manual? Okay, in the previous session, I've given a detailed description about the 3 different categories of part B. So this is from the second category, manual. So what is a manual? Okay, any idea? What is a manual? Okay, already you guys got the correct answer. Okay, fine. So what is a manual? Let me know in the comments. What is a manual? Yes, I know. Hi. Okay, so what is a manual? Manual, which means a small booklet which contains all the information regarding a particular machine, device, equipment, instrument or a medicine. Okay, so here this is all about an instrument which is a programmer they are asking you. So I'm just writing down here. This comes from the second category, which is a manual, and we are reading for the main idea. Okay, so we are reading to the main idea. So what does this manual tells us about the programmer? Okay, so what are the keywords from the question? So as I told you in every classes, we have to mark the keywords just to understand the question. Okay, so because to complete part B, we have only 12 minutes maximum. Okay, so within this 12 minutes, we have to complete 6 questions. Okay, which is like multiple choice questions with 3 answer options. Okay, so what are the keywords from the question? Let me know in the comments. Okay, Yogeshwari, manual we are reading for the main idea. It's about instruments, medication, yes. Okay. Yeah, so what are the keywords from the question? So I can tell you my keywords from the question, which are manual, then programmer. Okay, I'm just marking only 2 keywords from the question. That's enough for me. So these are my keywords from the question. So what about you guys? What are the keywords from the question? Okay, Geeta, Aruna, okay, manual, main idea, very good. Okay, Soumya, programmer. Is that your keyword from the question? Very good. Okay. So when you read a question from part B, you have to always connect with each and every options. Okay, so I'm just connecting with my options. What does this manual tells us about the programmer that used to provide communications between generator and lead? So what are the keywords from the first option? Yeah. So manual, it's all about a programmer. Okay, Aniha. Yes, it is a manual. Yeah. So from first option, my keywords provide. Okay, then generator, lead. So these are my 3 keywords from the first option. And from the second one, can alter the therapy delivered by the pacemaker. So my keywords, alter, then delivered, pacemaker. Okay, and from option C, retract essential diagnostic data for optimally titrating the therapy. So my keywords, retract, okay, which means withdraw, and optimally, then therapy. So these are my keywords from these 3 options. Okay, and let's read the manual. Implantable cardiac pacemakers. The modern pacing system is comprised of 3 distinct components. So what are they? Pulse generator, lead, and programmer. The pulse generator houses the battery and the circuitry which generates and stimulates and senses electrical activity. The lead is an insulated wire that carries the stimulus from the generator to the heart and relays intrinsic cardiac signals back to the generator. The programmer is a telemetry device used to provide 2-way communications between the generator and the clinician. It can alter the therapy delivered by the pacemaker and retrieve diagnostic data that are essential for optimally titrating that therapy. So question is very clearly asking you regarding the programmer. So this pacemaker has 3 components. What are they? Pulse generator, lead, and programmer. So question is very clearly asking you regarding the programmer. So what is the correct answer here? How can we eliminate the options? Okay, the only method the only strategy that we are using here, it is elimination method. Okay, so how can we eliminate the options? What about option A? Used to provide communications between generator and lead. See, the programmer is a telemetry device used to provide 2-way communications between the generator and the clinician. It's not about generator and the lead. It's all about generator and the clinician. So that you can eliminate option A, which is I found it contradictory or opposite option. And option B can alter the therapy delivered by the pacemaker. Yes, I found that same exact line from the paragraph. It is in the last line. See, it can alter. So who can alter or what can alter? This programmer can alter the therapy delivered by the pacemaker. So that is exactly option B. And what about option C? Retract essential diagnostic data. So what do you mean by retraction or retract? Which means, yeah, withdraw. Okay, again it is just opposite. Here it is retrieve. Retrieve, which means what? Collect. Okay, so it's just opposite. So I'm eliminating option C also. This is my contradictory or opposite option. So whether you like it or not, my answer is option B. It can alter the therapy delivered by the pacemaker. Okay, so that's the correct answer. Any doubts in that? Okay, Aniha, it's not lead. Very good, dear. It's all about the clinician, right? Yeah. Okay, so I think, okay, Yogeshwari got the correct answer. Okay, Soumya and Sarala. Okay, Anu. Okay, got the correct answer. Very good. Okay, Abhi, it's looking for the main idea. Very good, dear. Okay, option B from 6th line, option A will be eliminated because generator and clinician, not the lead. Very good. Option C will be eliminated because it is retrieve, not retract. Very good, Abhi. It's correct. Okay, very good. Okay, so that's option B. So now let's move to the first important part from reading module, which is part A. Okay, so we have another new different topic here, which is Klinefelter syndrome. Okay, yes, Klinefelter syndrome. Okay, so what about part A? It's a very common Okay, through live classes, you guys already know how to complete part A within 15 minutes. Yes, it's all about 15 minutes. And within this 15 minutes, we have to complete almost 20 questions. Okay, and out of this 20 questions, it can be categorized into 3 different sessions. The first one, 1 to 7 set of questions, which can be categorized into match the following questions. And 8 to 17 questions, which are short answer questions, and the rest of it is all about fill in the blanks, right? Yes. Okay, so here comes the new topic. Then, when you read part A, as you guys know, we have 4 different texts. Text A, text B, text C, and text D. Okay, so what is important in part A? What are the things that you have to take care of while reading part A? Any important things that you have to take care of? Yes, it's all about the strategy. So what is the strategy? Let me in the comments. What is the strategy that we are using here in part A? Okay, in part A, it was all about part B and part C also. It was all about elimination method, right? Yeah. So what about part A? What is the strategy? Okay, skimming and scanning. Very good, Abhi. Yes, already you know everything, right? Okay, so skimming means quick look and scanning means detailed look. So what do you mean by detailed look? Let me know, please. What do you mean by detail? Skimming, I agree, okay? Which is quick look, yeah. So what do you mean by detailed look? Why it is all about detailed look? Yeah, it's about skimming and scanning. Aniha, very good. Yes. So what is detailed look? Okay, skimming, which is very easy as the name itself indicate, it is all about fast reading or speed reading or quick reading. And we have another term that is scanning. Okay, so what is scanning? Okay, which means, yes, the name indicate it is looking for keywords. Very good, Aniha. It's all about looking for keywords or searching for important words. Okay, so when you fast read each and every text within this 2 minutes, because we can't use this 15 minutes completely to read this text, because we have to finish 20 questions within the same. Okay, so within 2 minutes we have to skim and scan. Okay, so when you skim, when you quick read, we have to underline certain important words from each and every text. So only the scanning will help you to find out the important words. So what are the important keywords? Okay, how will you understand the important keywords? What are the important keywords? Okay, so important keywords which I can say, you can mark first of all the headings. Okay, so sometimes they will mention headings, sometimes they will not. It's up to the material. So if the title is given or if the heading is given, you can mark all the headings. Okay, then subheadings. Okay, then what is next? We can mark all the numbers. Okay, each and every numbers we can mark. Then signs and symbols. Okay, all the signs and symbols. Then comes to the names, pronouns, maybe name of a person, name of a country, name of a disease condition. So whatever names they have mentioned, mark all the names. Okay, then its next important thing is mark all the abbreviations. Abbreviations, which means short forms. Okay, so because short forms are accepted in when you write this short answer questions or fill in the blanks, short answer questions, abbreviations are accepted. So it's very important you have to mark all the abbreviations from here. Then I can say all the brackets. Okay, all the brackets, it is very important, as well as the words which are in italicized or bold words. Okay, already it is catchable, I know that, but still you can mark all the words which are italicized or in bold words. And the important words that indicate time showing words, because when you read these short answer questions, you can see a lot of questions which they will ask regarding the time, when. Okay, so likewise the WH question will be starting with when, like questions. It is important we have to know about that preposition, the time, the word indicates time. Okay, and the next important factor, you can mark all the words which are related to experiments. Okay, most probably there are a lot of questions. Okay, when you read this particular text also, you can read a lot of words that can be associated with experiment. Okay, as well as the words which can be connected with research topics. Okay, majority, I can say most of the time, maybe text C and text D is all about this research. Okay, results, outcome. So and as well as the words that indicate Yes, research. And the final two important things that are, you can give special focus to the first and last line of each and every paragraphs as well as all the bullet points. Okay, I'm not saying you have to mark everything, but still just give special attention to the first and last line as well as the bullet points, okay, which are really important. Okay, so that's all about the 13 keyword. Then, so now we are gonna read each and every text. Okay, so the first text, Klinefelter syndrome is a genetic disorder in which people assigned male at birth AMAB have an additional X chromosome in their genetic code. So first of all, I'm just marking the first, the name of the syndrome as well as something in bracket. Okay, yeah, okay, something in bracket, have an additional X chromosome in their genetic code. Most AMAB have 46 chromosomes packages of DNA. This includes one copy of an X chromosome and one copy of Y chromosome, 46XY. People with Klinefelter syndrome have a total of 47 chromosomes, 47XXY. Klinefelter syndrome is one of the most common chromosomes conditions in newborns. It affects between 1 in 500 and 1 in 1000 newborn males. Variants of the disease with 3, 4 or more extra X chromosomes are less common. Then, these variants affect 1 in 50,000 or fewer newborns. It is possible that Klinefelter syndrome affects even more male children and adults than statistics suggest. Females who have pregnancies after 35 are slightly more likely to give birth to baby with Klinefelter syndrome. Okay, so as you can see here, these are the keywords from text A. So these are my keywords from text A. Okay, so what about you? What are your keywords from text A? May I know in the comments? At least 5. Okay, at least 5 keywords that you have marked from text A. What are the keywords? Okay, Abhi, heading, subheading, numbers, signs and symbols, names, abbreviations, brackets, bold or italics, words indicate time, first and last line. Okay, and 2 important points you missed, which are words indicate experiment as well as the words which indicate research. Okay, clear? Yeah. Okay, Riba, words indicate research, words indicate time, abbreviations, italicized or bold letters. Very good. Okay, Aniha, heading, subheading, numbers, signs and symbols, names, abbreviations, all things in brackets, italicized, indicators regarding time, words related to experiments. Okay, research, bullet points. Very good, very good. Okay, Riba, heading, subheading, brackets, signs and symbols. Okay, dear. Okay, so that's all about. Yeah. Okay, so now we are moving to B, text B. So there are 2 general types of symptoms, physical and neurological. Physical symptoms of Klinefelter syndrome affects your body and how it works. These symptoms may include a smaller penis, undescended testicles, atypical body proportions like being really tall or having long legs and short trunk, then flat feet, radio-ulnar synostosis, then coordination tissues, testicular failure, increased breast tissue. Okay, something has happened in between, so yes, I'm marking it again. Okay, increased breast tissue, then increased risk of blood clots, neurological symptoms, then depression, anxiety, social emotion, behavioral issues, impulsive behaviors, learning differences, attention, then ADHD, speech delays, autism spectrum disorder. So these are the problems, okay, whether it is physical problems as well as psychological or neurological problems. Then text C, it's all about some other risk factors, fetal development, then childhood or adolescence. I'm marking just all the brackets here. Okay, during, then Klinefelter, testosterone, then adulthood. Okay, so people with mild cases of Klinefelter syndrome, those without symptoms may never even know they have the condition. For others, their providers only discover it during infertility testing. Then the goal of testing is to detect and identify the extra X chromosome. The most common way to do this is with a karyotype test, which is a blood test, tells your provider and the number of types of chromosomes present. Providers can use karyotyping on children, adults, and even in fetuses before birth. Then healthcare providers recommend neuropsychological testing for children with Klinefelter syndrome. This can help identify and learning challenges and guide educators on how to help your child succeed. So these are my keywords from text C. Then comes to the last one, which is a table. Okay, as you know, one of the texts will be a pictorial of something. So yeah, testosterone replacement therapy. Yeah. Okay. So replacement therapy. And we have a lot of medications mentioned, then pediatric dose, adult dose, contraindications mentioned, interactions, precautions. Okay. And a lot of numbers, 200 mg, 11 to 12 years, 2 to 3 weeks, and the dose, okay, measurement is mentioned. So that's all about text D. So now comes to the first question from the first set of questions. So you can find the answer either from A, B, C or D. Okay, so the first one, those rigorously exposed to Klinefelter syndrome. So which means those, okay, so the patients or those patients strictly, rigorously, which means very strong or strict. Okay, so strictly exposed to Klinefelter syndrome. So where is that answer comes from? Where is it? That prevalence, or I can say the affected people. Yeah, that is the most apt word for this. Rigorously exposed to Klinefelter syndrome. So affected people, it is all about text A. See the first and second para, it's all about the affected people. This genetic disorder in which people assigned male at birth have an additional X chromosome. That's all about the first and second para. Okay, newborn males, then as well as it is possible that Klinefelter syndrome affects even more male children. So text A is all about the affected people. So I can say that answer is from text A. Very good. A lot of correct answers. Okay. 1 second. Okay, honey. It is text A. Okay, Sarala, Dennis. It is text A. Aniha, Anu. Okay, Jace, John. Ma'am, while writing down the answers, is it necessary to write down the articles also? Okay. So for example, when you write short answer questions, okay, and fill in the blanks, okay, first of all, I'll tell you regarding the fill in the blanks section. And majority or most of the time in fill in the blanks, they will mention the articles already. Okay, for example, A and the, these are the 3 articles in English language. So already majority of the time I can say in fill in the blanks, they will mention the articles. So you don't have to repeat the same. When I come to this short answer questions, okay, if it is not given in the question, understood? If the article is not given in the question, you can repeat the article. You have to, it is very important. So you have to repeat the article. Articles are very important. Okay. So if it is not mentioned in the question, you can repeat the article. If it is mentioned, you don't have to. Understood? Okay, Jace? I hope it is clear for you. Okay. So coming to the second question. Number 2. The 2 discrete kinds of symptoms discerned in people with Klinefelter syndrome. So discrete kinds, which means different types. Okay, different kinds. So the 2 different kinds of symptoms discerned. What do you mean by discerned? Okay, 2. So my keywords 2, discrete, discerned. So discerned, I can say something we discern, which means noticed, identified. Okay, so that is discerned. So the 2 discrete kinds of symptoms discerned in people with Klinefelter syndrome. So which is very easy. Those 2 types. What are the 2 types mentioned? Physical and neurological. So my answer is from text B. So it is B. Clear? Okay. Okay, most welcome, Jace. Yes. Okay. Okay, honey, it's B. Anika, it is B. Sarala, Dennis, it is B. Okay, Anu Thomas, it is from D. Very good. Exactly. And what about the third one? Aspects taken in cogitation prior to performing testosterone replacement therapy. So even though, okay, for example, even though you have no idea regarding what are the other words mentioned in the question, you can follow the next words. Okay, for example, testosterone replacement therapy. Where is it mentioned? Okay, for example, you have no idea what do you mean by aspects. You have no idea. Cogitation, no idea. So then you can, okay, search for other keywords. What are the other 3 keywords here? Testosterone replacement therapy. So where is it mentioned about this replacement therapy? Okay, so which is from here? It is text D. Okay, so that's all about D. Okay, A, it's B, and third question, that's from D. Okay, so before that, aspects, which means what? Levels or factors. Okay, approaches, levels, factors, that is called aspects. And what is the next thing? cogitation. So what do you mean by cogitation? Cogitation, which means different, I can say, considerations. Okay, so cogitation, which means the considerations. So, yeah, so what is the correct answer here? What are the aspects or factors taken in consideration prior, which means before, performing testosterone replacement therapy? So that is from text D. Okay. Okay, Shiny, you are back. Happy to see you back. I'm so happy to see you, dear. Okay, yes. Then, okay, Soumya, it's text D. Okay, Anu, text D. Okay, Honey, Aniha, it is text D. Very good. Yes, a lot of correct answers. Then, fourth one. How does Klinefelter syndrome mentally affect a person? So, my keywords, it's mentally affect person. So, what is your answer here? How does Klinefelter syndrome mentally affect a person? So, where is it mentioned? In which text the answer is from? Any idea? Fourth one, where they have mentioned about this mental affection, or yeah, physical and mental. So, not physical, they're asking you regarding the mental. So, yes, it is from text B. See, physical, neurological. So, in the last, not last actually, yeah, this particular page they've mentioned about emotional, behavioral, okay, so anxiety, depression, that's all connected to mental problems, right? So, answer is from B. Anyone got B? Oh, okay. Okay, Honey, Aniga, Anu, Nimisha, Sarala, Soumya, it is from text B. Then, fifth one, the benefits of neuropsychological testing in children with Klinefelter syndrome. So, benefits, the neuropsychological testing. Okay, so in which text? Benefits of this particular testing mentioned. Any idea? Benefits of neuropsychological testing in children. Hi Kirtu, good evening. How are you, dear? Okay, Anu, is that from text C? Any other answers? Text C, okay, Sarala? Okay, Nisa, B. Okay. Okay, C. Okay, Soumya, C. Okay, Aniha, C. Okay. Any other answers? Okay, Honey, it is from C. Okay, so the benefits of neuropsychological testing, majority of the answers, it is from text C. I'm just looking into text C. Where is it mentioned? Yeah, it is from the last para. Healthcare providers recommend a neuropsychological testing. So that is my keyword for children with Klinefelter syndrome. This can help identify. So what is the benefit? It can identify any learning challenges and guide educators on how to help your child succeed. Okay, so that is from C. So, answer is C. Okay, okay, Kirtu, I'm so happy to hear that. Okay, dear. Then, sixth one, dispensing the dose of drug in juvenile. So, dispensing, then dose, juvenile. Juvenile, which means children, right? Yeah. So, dispensing the dose of drug in juvenile, which means how you will, not how, yeah, providing medicine to children. Where is it mentioned? Okay, as you can see here, medication is mentioned in text D, I guess, yes. Okay, so what about, yes, pediatric dose. That is connected to juvenile, I mean children. So my answer is from, very good, text D. Okay, so other answers has gone. I'm just writing it down once again. A, B, D, B, and fifth one was in text C. Then sixth one, it is from D. Okay, then the last one. Okay, okay, Kirtu, okay, Anu, Soumya, Honey, Sarala, Aniha, it is text D. So, what about the last one, seventh one? Which are the conventional methods to ascertain Klinefelter syndrome? Conventional, so conventional has actually a lot of meanings, okay? Traditional, natural, usual, mostly used, okay? And most probably they will use all these synonyms. Okay, so conventional, traditional, mostly used, natural, usually, usual, common. Okay, so which are the, here I think conventional methods which they are connected to usual. Okay, so which are the usual methods to ascertain Klinefelter syndrome? So ascertain, as you already know, which means identify, right? Detect. So which are the conventional usual methods to detect Klinefelter syndrome? Any idea? 7th one. Kirtu got the correct answer. It is from text C. Okay, Anu, Aniha? Text C, sorry. Yes, honey, it is text C. So answer is from C. Okay, so where is it mentioned? In text C. Okay, so it's all from the first paragraph. If they detect the condition, it usually happens when running genetic test. So that is from text C. Okay, so that's that. 1 to 7. Any doubts in any of the questions? If you have any doubts, you can of course comment in this comment section. Definitely I'll reach you back. Okay, so now, okay Kirtu, very good, you got 7 out of 7. Excellent, dear. Anyone else with 7 out of 7 for the first set of questions? Okay, anyone got 7 out of 7 other than Kirtu? Anu Thomas, very good, excellent, dear. Then okay, honey, 7 out of 7. Okay, Sarala Dennis, it is 7 out of 7. I'm so happy. Okay, Anika, very good, dear. Okay, so that's all about 1 to 7 set of questions. So now we are moving to 8 to 14. Okay, so you can answer it in a word or a short phrase. Okay, yeah, answer in a word or a short phrase. So what do you mean by short phrase? Okay, I'm just repeating the same thing again and again and again. I know that, but because it is very important. Okay, so you can answer it in a word or a short phrase, which means maximum 3 words, not more than that. Okay, so 8th one. Okay, word or a short phrase, which means maximum 3 words. Yeah. 8th one, the condition when there is an atypical relatedness between the 2 main bonds in your forearm. Okay, Nimisha, you got also 7. Very good, dear. Okay. Yes, Anika, 7 out of 7. Excellent. Okay. So what are the keywords from 8th question? And what is your answer there? The condition when there is an atypical relatedness between the 2 main bonds in your forearm. So my keywords: condition, atypical, 2. Clear? Okay. So what is the correct answer here? The condition when there is an atypical relatedness, correlation, association. Atypical, which means not common, uncommon, right? Yeah. So yes, what is the correct answer here? Okay, Anu, very good. Okay, first answer, it is radio-ulnar synostosis. Okay, which is mentioned in which text? Yes, that is from text B. Answer is radio-ulnar synostosis. When there is an abnormal connection. So abnormal, which indicates atypical from the question. Okay, connection, yeah, it is relatedness mentioned there. Between 2, that is another keyword, bonds in your forearm. So answer is radio-ulnar synostosis. Okay, Nimi. Okay, Jobina. Hi, dear. Okay, Anu, Jobina, Nimi, Aniha, it is radio-ulnar synostosis. Okay, Kirtu, it is very good, dear. It is from text B, exactly. And now, 9th one. Children of what age are primarily treated with testosterone replacement therapy? So my keywords: children, age, as well as primarily. Okay, so testosterone replacement therapy, as you know, which is from text D, and pediatric dose. So what about the correct answer? It is 11 to 12 years. Okay, so children's dose, which is mentioned here, that's all about 11 to 12 years. So answer is 11 to 12 years from text D. First one, which is from text B. Second one, it was from text B. Yeah, answer is 11 to 12 years. Okay. Yeah, if the years are not mentioned there, you don't have to write that years there. Okay, if it is mentioned here, it is mentioned. What? 11 years is directly mentioned there. If the years not mentioned, you don't have to write. Okay, additionally, like 11 years. It is mentioned here so that you can write 11 years. Clear? Then 10th one. The approved process to identify an extra X chromosome in the people with Klinefelter syndrome. So my keywords: approved, process, then X chromosome. Okay, So approved process, which means what is approved process here? Okay, so what is the correct answer? Approved process or the method to identify an extra chromosome in people with Klinefelter syndrome. So what is the test or what is the process mentioned here? The usual or the most important process. Okay, and the goal of testing is to detect and identify an extra X chromosome. So these are the keywords. See, detect, identify. The most common way to do this is with a karyotype test. So our answer should be karyotype test. Okay. Okay, Kirtu, it is karyotype test here. Okay, Nimi, Mary, Abraham, karyotype test. Aniha, okay, Sarala, it is karyotype test. Okay, so karyotype is the first word, test is another word. Okay, so answer should be karyotype tests. Then, 11th one, name the medications used to conduct testosterone replacement therapy in both children and adults. So, name the medication. What are the medications mentioned? Okay, so what are the medications mentioned for children and adults? Okay, so I think medications which are from text D. Okay, and what is the medication mentioned for adults and children? See, testosterone, ethanoate or cypionate. Okay, cypionate or testosterone, ethanoate. So these are the answers. Okay, so maximum 3 words, and I think those are 3 words. The testosterone, ethanoate, and you can put also a bar also. Get okay, so that is cypionate. So both are correct. Then yeah. So 12th one, right? Yes, 12th one. How would be the genetic code of a person with Klinefelter syndrome? So genetic code. So where they've mentioned about genetic codes, okay? So which is mentioned, I guess, in text A, and I'm looking for that answer in text A. And I found it here, the codes mentioned. See, okay, 46XY as well as 47XXY. So what are the other keywords mentioned? Whether it is 47XY or XXY. Okay, Kirtu, it is 47XXY, right? So how would be the genetic code of a person with Klinefelter syndrome? Okay, so the answer should be yes, it is people with Klinefelter syndrome have a total of 47 chromosomes, that is 47XXY. Very good. Okay, so that is the correct answer, and those XXY should be in capital letters, okay, not in small letters. Yeah. Okay, Sarala and Anu, it should be, yeah, capital letters, yes. Okay, so the next one, 13th one, the succeeding of which age in women may label them as the complicated ones to deliver child with Klinefelter syndrome. Okay, so my keyword succeeding age women. So what is the correct answer here? They are asking you regarding which age. Which age? Okay, Kirtu, you have only written one drug. Actually, it is wrong, dear, because your answer is correct, I know. Because the name of the drug is mentioned there. But the problem is that they are asking you regarding medications. Okay, so what do you mean by medications? It is plural, medicines. So we need more than one. Okay, so answer should be more than one. So that is why what I told you. It is 2 medications. Okay, clear? It's okay. Okay, next time you can take care of that. Okay, so yeah, which age? Okay, 35. So which age? They are not asking you regarding other prepositions there, only they are asking you regarding the age. Which age? So which means they need the number. So you don't have to write after 35. Answer should be just, okay, 35. That should be the correct answer, okay? And 35 is mentioned in text A. See, 35. Okay, yes, Jobina, it is 35. Okay, Anu. Okay, Aniha, it's not after 35, dear, it is just 35. Okay, okay, Sarala, 35. Okay, Kirtu, 35. Yeah. Okay, so now next one. So the last one from short answer questions, 14th. What instance other than fertility issues make someone to have the test for Klinefelter syndrome in their adulthood? Okay, so instance, fertility, and adulthood. So these are my keywords from 14th question. And any answers for that one? 14th one, what instance other than fertility issues? What is the other problem other than fertility issues? Okay, so other than fertility issues, which is mentioned here in text C. Okay, so what is the problem? Low testosterone, okay, which is mentioned here in text B. Yes, it is in, sorry, text C. Yeah, adulthood. So what about that? Your provider may test for Klinefelter if you have a low testosterone or fertility issue. So as you can see there, fertility issues already mentioned in the question. So you don't have to write it. You can write low testosterone from text C. Okay, that should be the correct answer. Okay. Yes, it is low testosterone, Aniha. Yes, Anu, Kirtu. Okay, Sarala. Okay, Anjana, it is low testosterone. Very good. Then next one is, yeah. So now that's all about 14. Then 15th one, same instructions mentioned. 15th one, diagnosis of the condition typically ensues when running genetic tests like DASH or amino synthesis are conducted for other rationalities, means other reasons. Okay, rationales, which means other reasons. Yes, identification of the condition typically ensues, which means follows. Okay, so what is the correct answer here? Dash. 15th one, diagnosis of the condition typically ensues followed, okay, when running genetic tests like DASH or amino synthesis. It is chorionic-Willis sampling. Very good. Okay, chorionic-Willis sampling, and that is from which text? It is mentioned chorionic-Willis sampling, which is mentioned in which text? Okay, so that is from text C. See, this should be the correct answer. Already amino synthesis is mentioned there in the question, so answer should be chorionic-Willis sampling. Then 60. Okay, Kirtu, it is from text C. Very good, dear. Okay, Anu, chorionic-Willis sampling. Okay, Nimi. Okay, Anjana. Then what about 16th one? Klinefelter syndrome is a genetic disorder in which individuals assigned male at birth, AMAB, have a supplemental, which means additional dash in their genetic code. So genetic code, supplemental, as well as genetic disorder. Where is it mentioned? Okay, so maybe it is from text A, I guess. And answer should be, what is the correct answer here? Any idea? Yes, it is from text A, X chromosome. See, additional, it is supplemental. So answer is X chromosome. Okay, answer should be X chromosome from text A. Okay. Okay, Anjana. Okay, Kirtu, actually that X should be in capital letter, okay? Okay. Okay, Anu. Yeah. Okay, Jina, it is X chromosome. Okay. Yes, very good. Then 17. Testosterone therapy will enhance the action of DASH as well as the clearance of propranolol. The name of the medicine? Then testosterone enhance. What about 17th one? Of course, the medications mentioned in text D. Okay, and I found propranolol here. So what is another medicine? Enhanced action of warfarin. Okay, so answer should be warfarin from text D. Okay. Okay, Anjana, very good. Okay, Kirtu, you got also the correct answer. It is from text D. Warfarin should be the correct answer. Okay, Anu, it is warfarin. Okay, Gina, warfarin from text D. Very good. Then, next one. 18th one. People with Klinefelter syndrome have abnormal body proportions like being really tall or having long legs and short dash. So what's that? Okay, so symptoms and the problem. So yes, a typical, that is abnormal body proportions like being really tall, keyword, long legs, another keyword, and dash. So what is it? Short trunk. Okay, so answer should be trunk from text B. Okay, already that article is mentioned there, then short is mentioned, so answer should be trunk. Okay, I know it is trunk. Okay, Sarala, it is trunk. Okay, Gina, it is trunk from text B. Then second last one, 19th one. Dash for children with Klinefelter syndrome can help identify any learning challenges and guide educators on how to help your child succeed. Okay, so what is the correct answer here? 19th one. Children with Klinefelter syndrome identify learning challenges and guide educators. So I think that question is asking you from text C. Okay, and what is the correct answer here? Okay, it is from the last para. Healthcare providers recommend neuropsychological testing for children with Klinefelter syndrome. This can help identify learning challenges as well as guide educators. So answer should be neuropsychological testing. Okay. Oh, a lot of correct answers. Okay, Kirtu, Anjana. Okay, Anu. Yes, it is. Okay, Sarala, it is neuropsychological testing. So what about the last question? 20. Variants of Klinefelter syndrome with 3, 4 or more extra chromosomes are less common and affect dash or fewer newborns. Okay, Gina, very good. So what about 20th one, dear? Any idea? The last question. Where is it from? 3, 4 or more extra X chromosomes. Yes. So it is from text A, second para. They are asking you regarding these variants affecting 1 in 50,000 or fewer newborn. So answer is 1 in 50,000. Okay, very good. 1 in 50,000. Okay, Anjana. Okay, Anu. Yes, Kirtu and Sarala, it is 1 in 50,000. Very good. So anyone with 20 out of 20 for Klinefelter syndrome? Yes, Gina, it is 1 in 50,000. Yes. So anyone with 20 out of 20? May I know in the comments? For Klinefelter syndrome, anyone with 20 out of 20? Okay. Okay, I know you got 19, dear. It's okay. Within 10 minutes. Oh, excellent. Very good. Okay, Kirtu, your score is 18. Okay, out of 20, you got 18. Finished within 13 seconds, right? 13 minutes and 22 seconds. Okay. You got 20 out of 20, Sarala. Okay, excellent, dear. And what about the timing, dear? Sarala, is it 15 minutes or less than that? Okay, Anjana, 19. Very good, excellent. Okay, so when you see this live session, okay, when you guys see this video, please comment your answers also, okay, so that I can correct you also. Okay, I hope it is clear for you, everyone, and God bless you all. See you tomorrow.